So first, a little bit of information about the Center for Healthcare Rights. So you might have heard of us referred to as HICAP or SHIP, or Center for Healthcare Rights, or that Medicare agency that helps me with accessing my benefits. So we are LA County's Medicare and Medi-Cal counseling and advocacy agency. Now I know that Cancer Support Community, Westlake Village does serve folks in Ventura and Santa Barbara. Unfortunately, you guys wouldn't call us if you live in Ventura or Santa Barbara, but there are HICAP or SHIP offices available in every county, and we can always look up those phone numbers and try to connect you if necessary. So just a little bit more background about us. We are not a part of Medicare or Medi-Cal. We are an independent nonprofit organization that gets funding to provide assistance related to Medicare and Medi-Cal. And we're not brokers. We're not endorsing or recommending any sort of specific insurance companies or plans. So although we can potentially help you make sense of your different options, we're not trying to sell you anything. One last thing that I wanted to share about our organization, as Veronica mentioned, we do provide obviously community education like this, and we do have a hotline. So if you have questions that I'm not able to answer at the end of today's webinar, which is entirely possible, as you're already familiar, Medicare and Medi-Cal are extremely complicated and have countless rules that sometimes seem like they don't make any sense. So I will do my best to answer questions at the end, but if I'm not able to answer, or if you have questions that come up down the road once you've been thinking through some of the information that I've shared during today's webinar, you can always give us a call. And our process is that you get scheduled for an appointment with a counselor. We're a small agency. We have fewer than 10 counselors for all of LA County. So right now our call wait time is not bad, but sometimes as we get closer to the open enrollment period in the fall, those wait times can go up. So like I said, you're welcome to give us a call. You'll get scheduled with a counselor, and you can speak to any of the counselors, have all the same information, and we'll be able to provide you with some information and assistance. Also, one final thing here about our organization is that in non-COVID-19 times, we do also have volunteer counselors who are stationed at a number of community sites. So although our office is located in central Los Angeles, I know that we do, again, in alternative times, not during time of coronavirus, we do have community placements for volunteers. So if you have questions or need assistance and prefer talking to somebody in person, that is potentially an option. Not currently, but down the road, maybe next year, we'll see. Okay, so what are we going to discuss today? First, we're going to talk a little bit about Medicare and Medi-Cal eligibility. So how do you even become eligible for these programs? How do you enroll? Medicare and Medi-Cal benefits. We want to know what these programs cover, whether there's overlap, how they coordinate. And then finally, we're actually going to talk about prescription drugs last. So the slide needs to be updated, sorry about that, but we will talk about prescription drugs at the end of the webinar. And again, I'm going to try to reserve quite a bit of time for questions if I can. We'll see how that goes. It's a lot of material to cover. I definitely don't expect you to remember everything I talk about today, but basically, why is this information important? We want you to be able to access the drugs and services that you need, that you're entitled to. We want to make sure that you're not overpaying if you potentially qualify for some sort of financial assistance or program to provide some sort of financial assistance. And then I also just want you to know, if something comes up, that you're triggered to maybe give us a call if you have questions that come up, or our counterpart in, if you live in another county. Okay, again, I don't expect you to remember all of this, so we will just go through these one by one and see where we end up. Okay, so first, let's talk about Medicare. What is Medicare? It's a federal health insurance program that provides health benefits to people who are either 65 or older, or people who are under 65 and have either a permanent or long-term disability. Now, one question that we do get asked from time to time is, oh, well, I have a lot of income, or I have very little income. How does that impact my eligibility for Medicare? Well, general eligibility is not based upon income or resources. Your income or resources might dictate how much you end up paying for your benefits, but it's not, Medicare is generally not, eligibility is not based on your income. Okay, so let's go a little bit more deeply into Medicare eligibility. And if we were all in the same room together, and if we all could be, interacting and talking, I'd be having people raise their hands. How many of you are already on Medicare? How many of you are already on Medi-Cal? How many of you have no idea what any of these programs mean? Unfortunately, we just don't get that same interaction over Zoom, but I will assume that some of you might be already on Medicare and some of you might be facing Medicare eligibility soon. Again, one last thing I'll say about this workshop in general is that some of these things might be relevant to some of you and some might be relevant to others. Hopefully you'll all get something out of it. Okay, so back to Medicare eligibility. So first, as we said, people age 65 and older. So generally, in order to be eligible for Medicare at age 65, you do have to have worked a certain number of work credits. So that's where you've worked and paid into Social Security over a number of years. Generally, you have to have 40 work credits. That amounts usually to about 10 years of work. For folks under age 65, if you are receiving SSDI, or Social Security Disability Benefits, you become eligible for Medicare after 24 months of receiving SSDI. So this presentation, this webinar today is not really going to talk about SSDI or disability eligibility. We're really focusing on Medicare. So one quick thing that I will mention is I know a lot of folks, when I worked at the CLRC, had questions about, okay, well, now I'm on SSDI, how can I expedite my Medicare enrollment? And unfortunately, there's not really a way to do that. It's either, you've reached age 65, or if you're receiving SSDI, you have to wait till that 25th month of receiving benefits. There's no sort of fast track to get the Medicare sooner. Under the SSDI umbrella, you can also qualify for Medicare if you have end-stage renal disease or if you have ALS. And then I know that there was one question about qualifying for Medicare as an immigrant. So folks who are 65 or older who are legal residents or US citizens who've lived in the US for at least 5 years can potentially enroll in Medicare. If they have, all the work credits, then they can qualify, just the same as any other citizen who is 65 or older. If they don't have the full work credits to qualify for, aspects of it that are free, then they could potentially enroll and pay more. But we'll talk a little bit more about the premium costs in a minute. Okay, so, we've mentioned now a couple times that there might be requirements to have a certain number of work credits, but Medicare does provide an avenue for eligibility for folks who were married or are married to somebody who has those work credits. So, thinking about maybe a family where the mom stayed home and wasn't in the workforce paying into Social Security for a number of years, that doesn't mean that she's out of luck and not, eligible for Medicare necessarily. If her spouse, or if she's currently married and she's been married at least 1 year, potentially she could enroll based on her spouse's record. You can qualify under a divorced spouse. So as long as the marriage lasted at least 10 years, you could potentially qualify on your ex-spouse's record. And if you're widowed, the marriage had to last at least 9 months. But again, this is another opportunity for eligibility, even if you don't have, the work credits with Social Security. Okay, so moving on here a little bit, we talked about eligibility for Medicare, but what does that get you, right? So Medicare has a number of different parts, and we're going to go through these one by one. So Medicare Part A is usually the one that folks get for free. If you've paid into Social Security and you have those 40 work credits, you will get Part A for free, no monthly premium. And that covers hospital services, so inpatient hospital care, some home health care. It's pretty limited, usually has to be skilled care and for a set amount of time. Skilled nursing care in a skilled nursing facility, or hospice care. So those are generally what's covered under Part A. One thing you will see that is not covered under Part A is custodial care or long-term nursing home care. So that is something that Medicare does not generally cover. If you need skilled nursing, so let's say you go into the hospital for a surgery, that would potentially be covered under Part A. Let's say you need some outpatient, or let's say you need some occupational or physical therapy afterwards to help you recuperate. Well, that might be skilled care that you're receiving at a skilled nursing facility. Again, Part A. Okay, so that's Part A. Like I said, free for most people. There is an option to potentially pay for Part A. If you don't have enough work credits, that could be, I think this year it's around $450 per month. So that's a lot of money. And that's why it's such a benefit to have that for free based on your work credits. Okay, moving to Part B. So Part B covers outpatient. So outpatient doctor's visits, ambulance services, labs, tests, durable medical equipment. So if you needed something like a wheelchair or a walker, those would be covered under Part B. Same with preventive care. Every year folks under Medicare have a free annual wellness visit, or if you're new to Medicare, you get a new to Medicare preventive services visit. That's all covered under Part B. Same with mental health services. Now, Part B does have a monthly premium, and most people pay in 2020, they pay $144.60 every month for Part B. If you're what's considered a high earner, so if you earn, I believe it's over $85,000 a year as an individual, or if you're married, I think it's over $176 or so $1,000, you might be assessed what's called an IRMA, or income related monthly adjustment allowance, or I forget what it stands for exactly, but that's for higher earners. I'm not going to go into a lot of detail about that. If you have specific questions about these additional fees, we can talk about that at the end. And then the final part of Medicare is Part D. So Part D stands for prescription drugs. And there's not a whole lot else to say about it. Part D covers prescription drugs. You'll notice here, though, that we're missing a part, right? So it goes from Part A to B to D. So sometimes you will hear people talking about Part C. I don't like using the term Part C because I think it's overly confusing, but that is referred to that's used to refer to Medicare Advantage plans, which we'll talk about in a second. So the main parts that you really need to be focused on are Parts A, B, and D. And the Part D, the prescription drug plans, those vary in cost pretty substantially, and that can vary depending on if you qualify for Medi-Cal or depending on just which plan you sign up for. I've seen them for as low as $0 per month, which we'll talk about a little bit later, up to, I don't know, $75, $90 per month. So there's a lot of give and take when it comes to these prescription drug plans. Okay, so one of the things that is most important to pay attention to when someone is initially becoming eligible for Medicare is whether they're in a specific enrollment period and whether or not it makes sense to enroll at that time, because if you delay enrolling in Medicare coverage, it is possible that if you don't qualify for something called a special enrollment period, you could face...
Tom, I'm listening to something, please.
Could everybody please mute yourselves? Thank you so much. So you don't want to get into a situation where you miss your enrollment period and end up facing lifetime late enrollment penalties. So the first enrollment period we're going to talk about is the initial enrollment period. So sometimes people will refer to that as the IEP. That stands for initial enrollment period. Begins 3 months before the month of Medicare eligibility and ends 3 months after. So the way that works in practice, for someone turning 65, their initial enrollment period will start 3 months before the month that they turn 65. It includes the month that they turn 65, and then includes the 3 months afterwards. So let's say, for example, I was turning 65 on April 1st. That means that January, February, March, I could enroll. The month of April, I could enroll. And then May, June, July, I would still have the opportunity to enroll in Medicare coverage and would not be considered late. So even if the coverage starts at a different time, sometimes there's a delay. If you enrolled a couple months after, the coverage might start later. What's important is the date of your enrollment. So as long as you're within that 7-month period, you're good to go. If for some reason you miss that initial enrollment period, maybe you weren't paying attention to your mail, or you didn't think you needed to sign up for Medicare, or life happens. There is each year something called the general enrollment period. So the general enrollment period is January 1st through March 31st every year, and you can enroll in Parts A and B during that time, but coverage does not start until July 1st of that year. So it's not really ideal to wait until the general enrollment period to apply for coverage, because you could face a pretty substantial gap in your coverage. There's not really any way to, again, expedite, if you enroll in March and it's the general enrollment period, you've missed your initial enrollment period, you have no choice but to wait until July 1st, unfortunately, for the Part B or Part A to kick in. Now, one thing that comes up pretty frequently, obviously 65 is pretty young in terms of the workforce these days, and a lot of people are choosing to work beyond their 65th birthdays. 65 doesn't seem to be a very common retirement age, at least not in LA County, where it's very expensive to live. So for some folks who have employer health coverage through a job and they're working, some folks will choose to delay their enrollment in Medicare because they are covered by an employer health plan. That's okay for the most part. There's a couple of important things to keep in mind regarding whether or not your prescription drug coverage is what's called credible. But it essentially, what happens is for folks who are continuing to work and delay their enrollment in Part B, because if you get Part A for free, there's no reason not to enroll at age 65. But if you delay the Part B because you don't want to be paying that monthly premium and you're already covered by an employer health plan, you have what's called a special enrollment period to enroll later on, once your group health plan coverage has ended, or if you make the decision that you would like to enroll in Medicare. So that's just one example of a special enrollment period. There are other special enrollment periods that exist. If you move, for example, from one county to another, you might have a special enrollment period to change your coverage. So there's other life events that might take place that would qualify you for a special enrollment period. But it's a lot to keep track of, and honestly, if you're not sure whether or not it makes sense for you to enroll in Medicare as soon as you're eligible, I would give us a call, because we can talk you through those options, talk you through the pros and cons of delaying or enrolling now, the costs associated. So that's what I would recommend, because we do see people that have run into some pretty unfortunate situations where they delayed coverage because they just didn't think they needed it. And then once they did need the Medicare, they either had a huge gap or they had to pay late enrollment penalties. So just another plug for our services. Feel free to give us a call if you're not sure about enrollment. One last enrollment period that's not mentioned on this slide is the annual enrollment period, where you can make changes to your plan. So that takes place every October 15th to December 7th. It's called the annual open enrollment period, or annual election period. And that's where you can make changes if you don't like your prescription drug plan, or if you're enrolled in a different plan and you want to adjust how you're receiving your Medicare coverage. That's when you can do it each fall, and then the changes are effective January 1st. And I know the enrollment periods are very confusing, so I'm happy to come back to this later. Okay, so your Medicare options. Now that we have talked a little bit about what Medicare covers, how to enroll, when you enroll, what are the options? I'm sure that some of you who are already enrolled in Medicare probably were inundated with mail and phone calls and maybe emails and whatever else. People get pretty aggressive when they know that you are going to be eligible for Medicare soon. So there's a couple of different ways you can receive your Medicare coverage. The first option is what's referred to as original Medicare. You might have heard it referred to as fee-for-service Medicare or straight Medicare, but a lot of people refer to it as original Medicare. So original Medicare is where you have Part A, Part B, so the hospital coverage, outpatient coverage, and then you enroll in a separate prescription drug plan. So the plan only covers your prescription drugs. Everything else is just coordinated through Medicare more generally, which means that you have a lot of flexibility to see whichever doctors you want, essentially, that accept Medicare. A lot of doctors nationwide accept Medicare. So, for folks who say, oh, well, I really like a PPO, and I really, PPO, I like that model. I want to be able to go see whatever doctors I want. For a lot of people, original Medicare is a good choice if they're looking for flexibility in terms of which doctors they can go see. Now, that sounds great, but one of the downsides of original Medicare is the out-of-pocket costs. Because with original Medicare, unless you also purchase what's called a Medigap or a Medicare supplement plan, or have Medi-Cal also, generally you have to pay a 20% coinsurance for services that you get. So whether that's at the hospital or outpatient services, you might face pretty significant out-of-pocket costs. I'm not going to go into a lot of detail about Medigaps, but we can talk about that at the end if folks have questions. So this is option number one, original Medicare, standalone drug plan lots of flexibility, but high out-of-pocket costs. Now, another option is to get something called a Medicare Advantage plan. Now, Medicare Advantage, which has a lovely sound to it, that name has a lovely sound, but it's quite different. And so it looks a little bit more like private health insurance coverage. So instead of having Parts A and B and a separate prescription drug plan, a Medicare Advantage plan is where you assign your Parts A, B, and D to a plan that has contracted with Medicare. So Medicare pays the plan a set amount every month to cover you, and then they're required to provide your coverage. So in LA County, all plans but one are HMOs. So if you don't like the HMO model, if you don't want to have to go through your primary care doctor to get referrals to specialists, to get prior authorizations, Medicare Advantage might not be a great option because most of them are HMOs and do follow that model. Now, a benefit of a Medicare Advantage plan is that unlike original Medicare, the out-of-pocket costs are usually significantly lower. So whereas with original Medicare, you might be paying, the Part B premium, then you might be paying a premium for the Part D plan, and then you also have these out-of-pocket costs. With a Medicare Advantage plan, your monthly out-of-pocket might just be the Part B premium, and then these plans usually have set amounts for copays. So for certain doctor visits, it might only be $5. For other services, it might be, $50, but it's a set amount as opposed to a 20% where that's a little bit maybe squishier and less clear about exactly how much you're going to be paying out of pocket. So, there's pros and cons to both options. I really can't say necessarily whether one is better than the other because so much is dependent on each, patient or client's individual situation. If you see a whole bunch of specialists and they're all over the place and they're not all going to be contracted with one plan, original Medicare might be a better option for you. If you don't really care about, seeing specific doctors, you really want to lower your out-of-pocket costs and, you're okay with, having maybe less flexibility, Medicare Advantage can be great. So that's really a personal choice and not necessarily something that we're able to, direct people one way or the other. But like I said, pros and cons. Okay. So now that we have covered a little bit of background related to Medicare, I'm going to change gears a little bit and talk a little bit about Medi-Cal. And again, some of this might apply to you, some of it might not. So just bear with me and then we will get to questions. I just wanted to share on this slide, the old card is on the left. So just the blue and white card, benefit identification card, that's the Medi-Cal card from the past. I know a lot of people still use those cards. In the last couple of years, I believe they've issued a new card with these poppies on it on the right-hand side. If you have the old one, that doesn't mean that you're wrong. It just means that you have an older card. They work the same. Okay, so one Medi-Cal program that I'm not really going to talk about today is the Magi Medi-Cal program. That is for folks who are under 65 and can qualify with income up to 138% of the federal poverty line, which is still quite low. I think that's around $1,400 per month for an individual. Most of our clients are, over 65 or disabled. So for folks who meet one of those criteria, Magi Medi-Cal is generally not an option. So if you receive SSI, you automatically qualify for Medi-Cal. It's called SSI linked Medi-Cal, and that's coordinated through the Social Security Administration. But if you don't receive SSI and you are 65 or older or disabled, you can potentially qualify for something called the Age Blind and Disabled Federal Poverty Limit Program. And as you can see, the income and resource limits are quite low. Actually quite a few of our clients who qualify for this program actually end up qualifying, or apply for this program, actually end up qualifying for Medi-Cal with something called a share of cost. So if you otherwise meet the requirements for Medi-Cal eligibility, let's say you have low assets and you are over 65, but let's say your income is a little bit over these limits, you might be approved with something called a share of cost. And a Medi-Cal share of cost kind of operates like a deductible, where it's an amount of money that you're supposed to spend down each month that you're trying to use Medi-Cal benefits. If you're not using Medi-Cal benefits, you don't have to spend anything down towards it. But it can be pretty challenging for folks to access Medi-Cal services if they have a share of cost. So I'm not going to go into too much more detail about share of cost right now, but if you or someone you know is facing something called, a share of cost, you can direct them to our agency and we can provide assistance and explanations for how to potentially eliminate that. So one of those ways, for certain folks who are over the income limit for the Age Blind and Disabled Medi-Cal program, there is another program called the Medi-Cal 250% Working Disabled program. It's a mouthful. So generally speaking, the 250% Working Disabled program is for folks who are either on SSDI or who had disability income, whether that was SSDI or state disability, that converted into Social Security retirement benefits. So even if you're over 65 now, but you were on SSDI before you turned 65, this program might be a good option, because as you can see from the slide, the income limit is substantially higher than on the previous screen, right? So for a single individual, $26.58 per month, whereas on the previous slide, it's more than twice as much. So disability income does not count towards the income limits. So I'll give you an example. Let's say I'm on SSDI and I'm getting $1,400 a month in benefits. Well, from the previous slide, we can see that my income is over the amount for the Age Blind and Disabled program. But, here we go. But it's clearly quite a bit lower than the limit for this program. And the fact that it's considered disability income, it's SSDI, they don't even count that towards the income limits. So again, examples of disability income: SSDI, workers' comp, California state disability. I think some veterans' disability benefits might count as well. And the way that this program works is that, generally speaking, someone has to meet the definition of disabled, and then they have to earn money by working at least 1 hour per month. Now, if you're on SSDI already, you might be familiar with, have you worked, are you meeting substantial gainful activity? Are you in your return to work program? Have you exceeded? All of that is separate from this. So I don't want this to confuse you in terms of other work requirements related to SSDI specifically. This is a Medi-Cal eligibility program. So when I say that you have to earn money by working at least 1 hour per month, that is very flexible. So I have clients all that run the gamut. So I had one client this past fall who is has stage 4 cancer. She breast cancer. She's on SSDI, but she's still able to work. You know, out. Well, this again pre-coronavirus, but she was still able to go in. I forget where exactly she was working. I think it was a department store, and so she had an actual job with actual pay stubs. She wasn't working that many hours, so she wasn't making that much money, but she was actively going and working. Now, most of my clients, that is not their situation. Most of them who are on this program are doing something much more informal, like babysitting, or you know, somebody is watering their neighbor's plants for 1 hour a month, $5, and that counts as work. There are some people that are even bedridden who are able to fold clothes for someone else in the household, and that counts. So I don't want the word working to trip you up here either, because it is really flexible, and it doesn't have to be formal work. Most of the people that I've talked to that are enrolled in the program are not doing formal work. So there are still the assets and resource limits. Things like 1 house and 1 car don't count generally towards Medi-Cal eligibility. And this program in particular, they also allow you to keep certain retirement funds, like a 401k or 403b or IRA. So that's another thing that's quite a bit different about this particular Medi-Cal program. And so the process for applying for this program, this is something that we can help with. We don't generally assist with just general Medi-Cal enrollment, but if it sounds like the 250% working disabled program might be an option for you, I would strongly recommend that you set up an appointment with us. We can help you fill out the Medi-Cal application, and then generally the things that you need to provide to the Department of Public Social Services are proof of disability, pay stubs, or an employment verification letter that identifies the employer and the amount of money that you're earning each month, and then current bank statements so that they can make sure that you're not over the asset limit. But it's a pretty straightforward process. And the one other thing I didn't mention about this program is that there are premiums that have to be paid, but it's on a sliding scale. And so most of my clients who are working, 1 hour a month, making $5 or $10 from their neighbor or their friend, they're only paying $20 a month for their Medi-Cal premium. And when you compare that to potentially having to pay hundreds of dollars towards a share of cost, or trying to eliminate a share of cost, the Medi-Cal 250% working disabled program does end up making a lot of sense for some folks. Obviously, some people can't really do any work, and that's unfortunate, and that's the reality. But for a lot of people, I think this is an underutilized program, and I am embarrassed to admit that I wasn't really familiar with it at all when I was working at CLRC. So hopefully we can help. If any of you guys need assistance in applying, we can certainly try to help with that. Okay, so regardless of which Medi-Cal program you are enrolled in, based on the ones that we've just discussed, so age, blind, and disabled, 250% working disabled program, Magi Medi-Cal, as long as you have what's called full Medi-Cal, all of these benefits that are on the screen are potentially available to you. So there is overlap with Medicare. So Medi-Cal also covers hospital care, prescriptions, doctor services, etc. But there are a number of benefits that are available only to Medi-Cal beneficiaries, not covered by original Medicare. So some examples: incontinence supplies, certain transportation services to and from doctor's appointments, long-term services and supports like nursing home care. IHSS stands for in-home supportive services. So maybe you're not at the point where you necessarily need to be in a nursing home, but you could use some additional assistance in the home. You know, that's something that Medi-Cal might cover for you if you qualify. And then there's dental care, vision services, hearing aids. A lot of these benefits are, so on the right hand of the screen, those are the ones that are Medi-Cal only. Now, some Medicare Advantage plans do cover some of these sort of supplemental benefits like dental care or vision services, but those are sometimes limited. Sometimes you have to pay an additional monthly premium towards, you know, to get those services through a Medicare Advantage plan. So that's not the only way to get those benefits. If you are eligible for Medi-Cal, you know, this is one option. Okay. Now, for most people who enroll in Medi-Cal, you are assigned or required to choose a Medi-Cal plan. Now, this is more important if Medi-Cal is your only health coverage. And we'll talk a little bit in just a few slides of how the benefits coordinate, but just so you are aware, if you are enrolling in Medi-Cal or if you currently have Medi-Cal coverage, you probably are enrolled in a managed care plan, most likely either Health Net or LA Care. Those are the two major ones. Now, you know, if you have Kaiser, if you have a Kaiser Medicare plan, you know, then it makes sense if you also have Medi-Cal to be in the Kaiser managed care plan. But, you know, it's pretty rare these days that people are able to get exceptions from the managed care model, especially, I mean, I think it's more common for people who have really complex health conditions and who maybe have a continuity of care issue. So let's say you had been getting, you know, chemotherapy treatments with one particular doctor, and then you became eligible for Medicare, or I'm sorry, Medi-Cal, and maybe that provider accepts Medi-Cal but isn't in the plan that you were assigned to. That's a situation where you might be able to petition, you know, either to switch out of the plan or to switch into a different one. But for most folks who have Medicare as their primary coverage, which plan you're in doesn't really make a huge difference in terms of your care. Okay, so how do Medicare and Medi-Cal work together? So as I sort of just alluded to, Medicare is, if you have both, Medicare is always going to be primary for Medicare covered services. So that comes up, you know, especially for folks who had Medi-Cal and then transitioned to Medicare with prescription drugs. We'll talk about that a little bit later. But for the most part, Medicare pays first, Medi-Cal pays second. And if you are going to see a new doctor, I always recommend before stepping foot in that door, you know, while you're making the appointment and maybe the, you know, day before you go in for the appointment, I would just confirm that the doctor will accept both Medicare and Medi-Cal as your secondary. You don't, like I said, you don't have to, let's say you have an LA Care Medi-Cal plan, that doesn't necessarily mean you have to go see a doctor who accepts the LA Care Medi-Cal plan. Your Medicare doctor doesn't have to contract with your plan to see you. They might, if you're in a Medicare Advantage plan, you would want to confirm that the doctor is part of that plan. But again, the Medi-Cal plans play a lot less of a role here. So one common question that we get from folks who have both Medicare and Medi-Cal is, my doctor's office is charging me the Medicare 20% copayment for a doctor office visit. Do I have to pay this? And the answer is no. If you have both Medicare and Medi-Cal, it's illegal for the doctor to bill you at your appointment for the copayment. Now, why is that? Well, there's something called balanced billing protections, and it also has to do with the way that Medi-Cal closes the gaps in your Medicare coverage. So if you have both Medicare and Medi-Cal, one of the benefits, in addition to being able to access, dental and vision and, incontinence supplies and those types of things that Medicare doesn't cover, Medi-Cal also pays the Part B premium every month. So that's $144 that's no longer coming out of your Social Security check. Medi-Cal covers your co-payments and deductibles. So, when we talked at the beginning about, okay, well, there's pros and cons about having original Medicare, and one of the cons is these huge out-of-pocket payments that you might be liable for. If you have Medi-Cal, that's less of a concern because Medi-Cal pays those co-payments and deductibles. And then, as I said, Medi-Cal provides some extra benefits not covered by Medicare, such as hearing aids and incontinence supplies. Okay. So finally, prescription drugs. So if you have both Medicare and Medi-Cal, you automatically get something called Extra Help. So Extra Help is a program through the Social Security Administration that provides people with lower income and lower assets basically financial assistance with prescription drugs. So if you have both Medicare and Medi-Cal, you have to enroll in a prescription drug plan, a Part D plan, or Medicare will auto assign you into a plan. So, some people don't really take a lot of prescription drugs, so it's not a huge, consideration. For others, you might have a huge long list of all of the different drugs that you're on, and it might be really important to make sure that whatever plan you're going to be enrolled in covers those drugs. That's something that we can also assist with. So we can help. Medicare.gov has a plan finder tool to help you select either a Medicare Advantage plan or a prescription drug plan. It can be kind of tedious to go through. So if you're not confident in your, computer skills, or you're just want another set of eyes to make sure that what you're looking at makes sense, that is another thing that we can provide assistance with in terms of looking at the prescription drug plans. So if you have Medicare and Medi-Cal and have the full Extra Help, your prescription drug costs should be only $1.30 for generic drugs or $3.90 for brand name drugs. And then the prescription drug plan should cost $0 per month. Now, if you don't have Medi-Cal, so I know some of you on the call today might not have Medi-Cal, so you might be wondering, okay, well, what can I get Extra Help even if I don't qualify for Medi-Cal? And the answer is maybe. So if you don't have Medi-Cal, you're not eligible for Medi-Cal and you're not going to be submitting an application, you can actually apply for Extra Help separately. You do that through the Social Security Administration. There's a really clear application on their website. Again, that's something else that we can also assist you with. And the income and asset limits are a little bit different. Every program seems to have different rules, so it's one more thing to keep track of. But for full Extra Help, if you don't qualify for Medi-Cal, generally your income has to be under around $1,400 per month, and you have to have assets that are less than about $9,000. So again, they don't count the house you live in or the car that you drive, but they're looking at savings or retirement accounts, that type of thing. If you're married, the limits are a little bit higher, so it's closer to about $2,000 per month in terms of income, and about $15,000 in terms of savings and assets. So again, that's something that we can definitely help you enroll in if you think that you might be eligible. If your income is a little bit higher than that, or if you have assets that are a little bit higher, there's also the potential to be eligible for what's called partial Extra Help. So, if you think that you're anywhere close to some of these eligibility criteria, I don't think it hurts to apply, because you might be surprised, and we're surprised sometimes by who they approve and who they don't. So that's just one last plug there for the Extra Help program. So as I mentioned, if you qualify for Extra Help, either separately or because you have Medi-Cal, you can get a $0 monthly premium prescription drug plan. This is a list of the plans that are currently available in LA County. They're called benchmark plans. And so if you have Extra Help, most likely you're already enrolled in one of these plans. I have spoken to some folks who, even though it was an option to have the $0 monthly premium plan, they opted to pay for some other plan. If that's your situation and you're happy, then you're not absolutely required to be in one of these, but it is an option available. So I mentioned also at the beginning that there are very sort of strict enrollment periods when you can sign up for Medicare, and that if you miss certain periods, you could face late enrollment penalties or gaps in coverage. So one thing that, obviously this is probably, not news to you, but folks who might be disabled and have both Medicare and Medi-Cal, or folks who have lower incomes, they might have more of a need to make changes to their coverage if let's say their prescriptions change or they have a progressive medical condition. So with the Extra Help program, you are granted 3 additional periods throughout the year where you can make changes to the way you receive your prescription drug coverage. And again, one thing I might not have made very clear at the beginning when I was talking about Medicare Advantage plans is that when we're talking about we're talking about prescription drug coverage under Medicare, we're talking either about a standalone Part D plan or a Medicare Advantage plan that includes prescription drug coverage. So when we're looking at these special enrollment periods where somebody who has Extra Help could make multiple changes throughout the year to their coverage, that doesn't necessarily mean that they could only switch, among these different prescription drug plans. That might mean that, in February, they're in a Kaiser Medicare Advantage plan, and they've decided that they want to make changes and enroll in a standalone drug plan, in April, and then maybe that's not really working for them, and they found a different doctor that they want to see that's in a different Medicare Advantage plan. They could make another change, let's say in August, to enroll in that Medicare Advantage plan. So when we're talking about making changes to Part D, that means either standalone prescription drug plan or Medicare Advantage that includes prescription drug coverage. Usually when you make changes to your Medicare coverage, just like with other insurance, the changes are effective on the first day of the following month. So, we talk to clients all the time who maybe are not happy with their plan, or they decide they want to change coverage. Okay, well, it's June 15th. If we make a change today, it's not going to go into effect until July 1st for the most part. So not a lot can be done, super urgently or super quickly, just because of all of the moving parts and the way that the coverages work. Okay, so, we talk to a lot of folks who are prescribed prescription drugs that either their plan doesn't cover, or their plan maybe charges more for than they were expecting. So one question that's pretty common is, what should I do if my 2020 Part D plan does not cover a drug that I need? Well, the first option is always to talk to your doctor and see if they can switch you to a different drug that is covered by the plan. I know this comes up a lot with brand name versus generic drugs. And so, sometimes the doctor might prescribe the brand name drug. The brand name might not be covered by the plan, but the generic is. if the generic works for you, the plan will sometimes just, switch that out automatically. Sometimes you can ask your doctor to provide a prescription specifically for the generic. Another option is always to ask your doctor for samples if it doesn't seem like, getting coverage is going to be an option. If you are eligible to make changes to your plan, you can always change your Part D plan to one that does cover the drug. That's also, an option available. And then a final option that, comes up pretty frequently, and I still have very fond memories of someone I spoke to a few years ago at Cancer Support Community Pasadena, who had a question related to exception requests. So, an exception request is where, if the doctor has prescribed something that's not covered under your formulary. So the formulary is the list of drugs that are covered by your plan. Then the doctor can request that the plan makes an exception and covers that, either because there are no other drugs on the formulary that will, provide the same type of, treatment, or, why other covered drugs are not appropriate for you. And usually this is something that has to be done each year. So it might get approved, and then if it's a prescription that you're going to be on for a while, you may need to, do that. Your doctor may need to help you with that again, the following year. But I still recall one woman that I spoke with, again, a Cancer Support Community Pasadena, who said, "Oh yeah, my doctor, filed the exception request, and I got approved for 50 years." And this lady was probably in her 70s. So she was just so delighted, because she knew that, whatever happened to her down the road, it wasn't going to be because she couldn't access that specific medication. Now that is very rare. Like I said, it is usually something that has to be done each year. That's the only time I've ever heard of anyone being approved for 50 years. But I guess it's nice to know that that's possible. So again, a lot of issues that come up related to prescription drugs can be addressed either by talking directly to your doctor, or talking to your plan and having them send, the proper forms to the doctor to fill out. But your doctor is going to be a really good advocate for you if you're trying to figure out prescription drug coverage. And then in terms of the actual plans, like I said, that's something that we can always help you review as well. Okay, I'm delighted that I was able to get through all of that material, and I'm sure that many of you might have questions. It looks like we've got about 25 minutes left for questions, so I'm happy to try to field some now if anyone has any.
Okay, so I'll go ahead